Eligible patients who are clinically and hemodynamically stable on Remodulin may be able to transition to Orenitram. A majority of patients in the study successfully transitioned with similar exposure.
Orenitram, treprostinil, extended-release tablets. Indication: Orenitram is a prostacyclin mimetic indicated for treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to delay disease progression and to improve exercise capacity. The studies that established effectiveness included predominantly patients with WHO functional class 2 through 3 symptoms and etiologies of idiopathic or heritable PAH, 66%, or PAH associated with connective tissue disease, 26%. Important safety information for Orenitram. Contraindications: avoid use of Orenitram in patients with severe hepatic impairment, child Pugh Class C, due to increases in systemic exposure. Warnings and precautions: abrupt discontinuation or sudden large reductions in dosage of Orenitram may result in worsening of PAH symptoms. The Orenitram tablet shell does not dissolve. In patients with diverticulosis, Orenitram tablets can lodge in a diverticulum. Adverse reactions: in the 12-week placebo-controlled monotherapy study and an event-driven placebo-controlled combination therapy study, adverse reactions that occurred at rates at least 5% higher on Orenitram than on placebo included headache, diarrhea, nausea, vomiting, flushing, pain in jaw, pain in extremity, hypokalemia, abdominal discomfort, and upper abdominal pain. Drug interactions: co-administration of Orenitram and the CYP2C8 enzyme inhibitor gemfibrozil increases exposure to treprostinil. Therefore, Orenitram dosage reduction may be necessary in these patients. Specific populations: animal reproductive studies with Orenitram have shown an adverse effect on the fetus. There are no adequate and well-controlled studies with Orenitram in pregnant women. It is not known whether treprostinil is excreted in human milk or if it affects the breastfed infant or milk production. Safety and effectiveness of Orenitram in pediatric patients have not been established. Use of Orenitram in patients aged 65 years and over demonstrated slightly higher absolute and relative adverse event rates compared to younger patients. Caution should be used when selecting a dose for geriatric patients. There is a marked increase in the systemic exposure to treprostinil in hepatically impaired patients. Please see full prescribing information and patient information at www.orenitram.com or call 1-877-UNITHER, 1-877-864-8437.